Welcome to the Patient First Podcast, the podcast about bridging the great disconnect, the gap between how dental professionals and their patients view dentistry. It is, I believe, the only way, the new way to grow the practice of your dreams. I'm your host, Dr. Bryan Laskin. Thank you so much for joining us for the second episode of the Patient First Podcast. I am super excited because this is something that I'm really passionate about, which is books being applied to dentistry. And this is our first one. And I think we have a really good one. It's a quick read. It is Effortless by Greg McKeown. Now, this book is something that somebody on our team, Megan, shout out to Megan, who gave this to me while I was going on a personal retreat where I was taking a couple of days off. And it was absolutely perfect because it really cemented in kind of why I was taking some time off and allowed me to focus on what I need to focus on. And I think the absolute ideal person to read Effortless is a dentist. And even more broadly, dental team members. Why? Why, Brian? Why is Effortless so geared towards dentists? Now, hopefully I'm not offending my audience in the second episode, but we dentists, myself included, tend to be a little bit of perfectionists, right? Why? Well, we work in nanometers. We do tiny microsurgeries all day long. And to actually be any good at our job, I think you kind of have to be a perfectionist. Now, what hygienist doesn't like air dry the mandibular anteriors for 12 times, looking for that last molecule of calculus to scrape off? A bad one, right? So we, by definition, we are perfectionists, right? To do our job at a high level, which hopefully, I think, if you're here looking to learn, you probably know that we have to do this at a high level. So we're perfectionists. We're also grinders. Like some of our job is, let's face it, being in dentistry is hard. It's stressful. So we tend to grind through any issues and to kind of push through the pain, so to speak, right? We grind it out. We do what needs to get done to get it done. And that also lends itself to overworking yourself, as you'll hear in a little bit. We also tend to pay our employees hourly. We look at our schedules and really refine our schedules. And we look at our schedules oftentimes production blocking. So we're looking at dollars for time a lot of times, which, as we'll talk about in a little bit too, can be a limiting mindset, right? And it's a huge problem because when you're looking at time as a value, like money as a value of time, it is the crusher, the killer, the absolute antithesis of creativity, of problem solving, of thinking bigger, of looking at like, okay, we are here, we're going to get to the next plateau. It's the killer of that. So what do I mean? Have you ever taken a vacation and just suddenly, as you're laying at the beach, you have a phenomenal idea? You think of something for business, for the practice, for your office, for the clinically. Oh my gosh, I'm going to do this now. Or you're like going to sleep, or you're waking up and you have an idea just spring to mind. Well, it's because you're relaxed, you're calm, and you're in, closer to you running out. If you study brainwave brainwaves at all, you're out of the sort of heavy, fast brainwave, the beta activity, and down into the more calmer theta waves. And that type of thinking, when you're calmer, is a different type of thinking than when you're like really processing fast and trying to think logically. And it's the kind of thinking that leads to high performance, particularly when it comes to problem solving. If you don't think you're problem solving in your office, think about what's going on now with trying to find team members, or how do we find the next assistant and onboard them correctly. That's a creative problem solving mindset that when you're grinding it through, that you're overworking yourself, you're just not in the right mindset to do that. And this book, Effortless, it kind of defines this. It talks a little bit more about into what I'm talking about, how you kind of really have to be in a different mindset in order to think creatively and how to get there. But I took away 3 big points, and then I've got a couple bonus ones that I came up out of my own life that for the dentists, for the dental teams listening. So this is Brian's 3 points that I got from the book Effortless, and then how you can apply it in your practice. Number 1, don't do more today than you can recover from by tomorrow. It's a key point that I'm trying to incorporate in my life right now. But what it means is that if you can't recover by all the efforts that you put in today, tomorrow, you're going to be depleted tomorrow. You're going to be less apt to do your highest performance. And I find this to be very true. And I squash it all the time. So then Greg McKeown goes on to say, if you can't do more, if you can't do less today so that you can recover by tomorrow, think of it from a week. Don't do more in a week than you can recover from by next week. Sometimes I got to stretch it out, to be honest. Maybe it's this month so that by the end of the month I'm recovered. But it's a key point of having the ability to recover, which is, frankly, I've gone through many periods of my life when I haven't done this, and it's just crushed my performance. I've not performed at my best, frankly. And we in dentistry have to perform at our best. But if you try to grind through and overwork, you are not going to be there. So how do we apply this to our practices? Well, Greg talks in this book about taking sprints of 90 minutes on and 10 minutes off. So an hour and a half on, 10 minutes off. Hour and a half is pretty much, if you study people's attention, it's about as much time as anybody can focus on anything is 90 minutes. So if you're doing an hour and a half long procedure, either schedule a break right afterwards or schedule something that feels like a break too afterwards. If you're going to be doing a quadrant of composites and it's not your favorite thing to do, but it's going to take an hour, maybe figure out a slot of something you can put in that's restorative in the middle. And if it's not going to be a scheduled break, something that feels more like a break to you, but 90 minutes on, 10 minutes off. And a lot of people I can hear saying, what can you do in 10 minutes? Well, a lot. I've been working on this for about the past year, and I can tell you that 10 minutes is all you really need to recover oftentimes for an hour and a half of heavy work. Here's what I do. My favorite thing to do is to go for a walk. As Fred Nietzsche said, all truly great thoughts are conceived by walking, right? I even have a treadmill that's attached to my desk so I can flip my monitor and walk as I'm thinking. If I'm writing, when I wrote my book, The Patient First Manifesto, if you don't have a copy, go to patientfirstbook.com and download it. You can get it for free. Just pay for shipping. But I wrote the book the entire time I was walking on my treadmill because I feel like it enhances creativity. It's better, obviously you can't write a book and go for a walk outside, but if you're thinking or even having a meeting where you're talking with somebody, go for a walk. Steve Jobs famously would, when he was problem solving with somebody, with one or two people, they would go for a walk together. So it really works. I think walks can be miraculous for creative thinking. Also, if you're in a bad mood, go for a walk. There's a saying, if you're in a bad mood, go for a walk. If you're still in a bad mood, go for a longer walk. I think that might be true. Other things you can do in 10 minutes. Deep breathing exercises, I think for the right people, deep breathing exercises or meditation can be very restorative. You can do a 10-minute yoga class that's very restorative. I like to play video games for 10 minutes. We just got a Star Wars pinball machine in the office. And I have to tell you, it's quite restorative to play a round of pinball. I don't know why, but for me, that's restorative. Or you can read. Read Greg McKeown's Effortless, in those 10-minute breaks, and you'd be surprised how much you can actually get done and refocus after 10 minutes. So tip number 1, don't do more today than you can recover from by tomorrow. Tip number 2, attach gratitude to every complaint. This one is hard. It's very hard, but it is massively impactful. It's something I'm working on a lot because I complain a lot. I used to complain a ton. In fact, when I was in college, I did research in a mouse lab, and they had a list of things Bryan hates on the wall. I remember because I was complaining ad nauseum about people who walk slowly. So now Bryan is trying, thanks to Greg McKeown, to attach gratitude to every complaint. And here's how this played out. The week after I read this book, I was driving with my 13-year-old son in the car next to me, and somebody cut me off in traffic. And I said an expletive that I don't normally say in front of my 13-year-old son. But then I had to explain to my son after he laughed because I threw out that expletive. I said, okay, I just read this book, Effortless by Greg McKeown. Great book. So what I'm trying to do is attach gratitude to every single statement, every complaint that I have. So my gratitude is going to be, after this guy cut me off in traffic, and this is what I said. Transportation is so easy now that even that moron can cut me off in traffic. Now, Not the most gratitude statement, not that proud of it. But then I was thinking about it, and I was thinking about how, if those of you who have watched older movies, or like me, grew up with older movies, where like Indiana Jones style stuff, where they put the key in the car and it goes, and it doesn't start, right? I mean, so I'm grateful that we have this rapid transportation that you don't really think about when you start your car now. Is it going to start? It just happens every time, right? And it really does reframe that complaint. And so what that does is it opens you up to be more positive, again, more creative thinking, and allow you to attack the day a little better. Now, in dentistry, I think the way we apply this to dentistry is easy. You might notice people in dentistry like to complain about patients, right? Well, those patients are what are the lifeblood of our practice, right? And also, they're probably the source of their complaint is probably patient anxiety. So if we can be grateful of our patients, we meaning all of us, including our team members, so when you hear somebody complain, it might be a good thing to apply to your practice. When you complain about a patient, you have to say something nice about them. Even if it's, we're getting rid of them, right? We're going to dismiss that patient because I can't find anything to be grateful about that person. So let's free them to find another practice, right? But have your team members, if you overhear them complaining about somebody, say, hey, what's one nice thing you could say about that patient or their family, or whatever. I think it will help reframe that relationship. And also, it's one of the most insidious things in a practice, complaining about patients. So number 3, I love this one too. Attach joy to the mundane. Greg talks about in the book these 2 examples that he had. One, he and his wife talk about finances, and they hate it. It's boring. Frankly, it's probably stressful. And so what they decided to do is, when they sit down to go over their finances, Greg and his wife have chocolate-covered almonds. Now, I don't know about you. I love chocolate-covered almonds. So this was a great idea. Brought to my wife. She added red wine. So now when we meet with chocolate almonds and red wine, it's like this little gift you look forward to going into something mundane. It's a phenomenal idea. It works really well. Greg talks about how his kids didn't like cleaning the table after dinner. So they put on music and created a dance party. So it was a dance party when they put the dishes away, and then they didn't have to go find the kids and force them to do their chores. It became something fun for the family to do after dinner. I think it's great. Where does this help in the office? Boring meetings, right? I think we all have meetings, or you might not even just boring. You might have something there's going to be some conflict in a meeting where you have to bring up something where you don't want to bring up. If you start off every meeting, we start off meetings with either a big win, where we go around the table and everybody talks about their big win for the last week, last month, last quarter, whatever, or else their personal best and their professional best. Depending on the team that I'm working with, it's either a big win or personal best and a professional best. Why do we do that? Well, it sets up the meeting to be positive. And also, frankly, you look forward to it every time. So when you're coming to the meeting, you're going to hear something positive right away. It breaks up that mundane, the monotony, and it's attaching joy to the mundane. So another way to bring this into your practice, beyond meetings, the lab, your sterilization center, might be a little mundane, right? So maybe bring in some music, have an iPod in there, or music where people can pick whatever they want to play. Just think of it how you can actually bring in those boring, mundane spots in your practice and bring some joy to them, or else outsource them completely or automate them, because nobody in dentistry wants to work. I mean, people don't go into dentistry to have boring jobs, right? We go into dentistry to help patients. And so if we can break up this monotony, the mundane aspects, you're going to attract the best employees and keep them. And also you'll have a lot more fun providing higher quality care to patients. So those are my 3 from Greg McKeown's book. And I promised you I was going to give you a couple more from my life. Tip number 1, which is a passion of mine. It's a very big one, I believe. So I would pay close attention to this one. Kill your to-do list. To-do lists, what are they? They're a never-ending list of hopes, dreams, and wishes that just don't come true. The list gets longer and longer and feels like this burden that's about to crush you. I think the reason why to-do lists are popular is because it feels really good to check something off. It gives you that little hit of dopamine, like a Facebook like or when somebody comments on something that you posted on social media. It's an artificial dopamine hit crossing something off your to-do list. But these lists just become barbaric and overwhelming. So what's the better way to keep track of to-dos? I don't have a to-do list. I put everything I'm going to do in my calendar. So it's in my calendar, and I honor those appointments with myself to get that task done. And if I don't get it done, I have to shift it to the next available time. Those things get done. If you live your life based on your calendar and then you put it in your calendar, I believe it's a much more effective way of handling your tasks that you need to get done. And then it really forces you to think, is this something that I need to get done? Because if an item is on your to-do list for 3 years, it doesn't need to happen, right? So kill your to-do list, put everything in your calendar. My last tip for you today is to track results, not time. This is a very challenging one for dentists because we keep track of time, right? We pay people by the hour. We think of everything this way, right? You think of a procedure, a crown. It takes an hour. It takes an hour and a half, whatever it is, and we're tracking everything by time. But there's a lot in our practices that cannot be measured by time. Think of it this way. Everybody knows, or at least has probably heard, that one of the most productive things you can have in your practice is an empty chair. That empty chair is for that patient that comes in that has a toothache, that needs a root canal and a crown, massively increasing because it's your variable profitability, your variable production, which adds tons of profitability. And so we need to have extra capacity in our practices. That's an example of results, not time. If you're thinking of like the limitation of, I want to have the most utilization of every chair all of the time. Well, when you have a little extra opportunity, you're going to lose it. And then also, if you have an office manager or somebody at the front desk that's punching a clock all the time, but they're not getting their major tasks done, that's a problem. It's a symptom that shows you that you're probably tracking time more than results. If you're giving people large projects and they're nailing them out of the park, but they're not there all the time, but I would urge you to not just look at the time people are working, look at the amount of effort they're putting in the time, which is a very difficult thing to do in dentistry. But I think, giving people work beyond what their sort of day-to-day hourly production is, particularly at the front desk, like I said, or if you give an office manager a project to get done and they just nail it but they seem to be doing it effortlessly, right? Hence the name of the book. It probably just means they're more effective, right? It doesn't mean, just because it takes somebody longer doesn't mean it's better, which is a tenet that we use at Upgrade Dental when we talk about prepping an idealized tooth in 2 minutes versus 10 minutes. I don't know about you, but if I can have an ideal crown done in 2 minutes versus 10 minutes, I would much rather have it done quicker on me. It's more efficient, right? Efficiency does not equal less quality. Oftentimes it can equal better quality. Another example of tracking results, not time. So thank you very much for joining me for this second episode of the Patient First podcast. It has been my honor to do this for you, and I'm looking forward to doing it a lot more. Thank you. Thank you.